You've been sitting down also for a long time, you will want to work on your ankle joint to make it to do some movements on the ankle joint, movements in all directions, up, down, to the sides. Yeah, this will really help to improve circulation in the joint and prevent the joint from swelling due to the prolonged sitting position, like that. You can do 6 to 10 repetitions of these movements for both feet. And then relax. Okay, so when sitting for long, or let's say especially when sitting for long, most of the times the structure surrounding your joint, the lymph nodes, the blood vessels, they have very little push. And because your muscles are not in action to assist these lymphatic vessels to move the fluid, or rather the lymph fluid upwards towards the lymph nodes, the lymph fluid tends to accumulate in your joints and thus cause the swelling. So the reason why we encourage doing these movements in the joints is to prevent the joint from swelling, and also to activate muscles that assist in, or rather they support the venous return of the flow of lymphatic fluids up towards the lymph nodes. So as you do this, you're activating the muscles at the back of your leg. We call them the calf muscles, which are considered as in layman's language, they call it the second heart. So as you do this, you're activating the calf muscles that in turn contract and help to push the lymphatic fluids in the lymphatic vessels up towards the lymph nodes, and thus preventing the swelling around the ankle, or rather reducing it for those who already have had experience, or for those who already have the swelling. So while standing in your office and you want to do some stretches, you can try doing this stretch for your ankle joint wherever you are, however small or big your workspace may be. You can just do this. You just stand, find a wall, or a wall around you. Just put your knee on the wall and then stretch the leg that's behind. So you'll feel a stretch all the way from below your knee to down, almost at the level of your ankle joint. So hold this position for 10 seconds and then relax. Then you just exchange the legs, put the other knee on the wall and stretch the leg that's behind. Feel the stretch all the way from below the knee down to your heels. Then done. Then to stretch your arms and your chest. While standing, you just interlink your hands, like when standing and you want to stretch your arms and your shoulders, you just interlink your arms like that, and then move your shoulders behind. Move your shoulders behind like that. Then hold this position for 10 seconds and then relax. You can also do some shoulder circles like that, moving your arms, or rather your shoulders, in a circular motion like that. Then move forwards in a forward motion like that. You can do some 5 repetitions of the movement and you're good. So for the do's, just a summary of what we have discussed. Ensure your seat is proper for you by measuring the seat how we discussed and how we demonstrated. Ensure you're not tilting your neck either downwards or upwards to avoid straining your neck. So you just be using your eyes to either look down or up. Also, we talked about arranging your workspace, where you put the things you are using frequently close, and those that you're not using frequently further away, so that they allow you to move, to wake up and move around the office, so that you're able to stretch a bit and walk a bit to allow better circulation for your muscles. Yeah. Also, we talked about doing some little stretches from now and then, 30 minutes after some work. You just wake up from your seat, do some stretches, or even do the ones that you can while seated. For the don'ts, we talked about straining your neck using your phone, like some of the people do. They just put they're just on the call, holding the phone with their neck and the shoulder as they work. Oh no, this really um, is risky for your neck, causing you. It could cause you a strain, even sometimes something as severe as a displacement of a displacement of your discs at the level of your neck, and many other uh, things that could result. Hapo nimekosa majina. Yes, and yes, and many other negative, yeah, many other issues that could result from those poor uh, postures. So what I will tell you is take care of yourselves, take care of your body, listen to your body. If tired, rest. Give it what it deserves. Give it good exercises. Give it stretches when it needs to. Uh, Also, visit the physiotherapist or clinicians whenever your body is complaining or you feel you have a problem before the problem escalates or it chronifies.